Hello, I'm Jim Demo with Clark County Close-Up. Thank you for meeting with us.
Thank you for having us on the show.
Okay, it's March 21st. So what's the latest with the measles outbreak?
So in Clark County, as of March 21st, we've had 73 confirmed cases. Of those cases, 5 of them were in adults. The rest of them, the other 68, were in children between the ages of 1 and 18. Of those cases, we've had 3 of those cases that have had one of the 2 recommended vaccine doses. We've got another 7 that are unverified. We're unable to tell one way or the other. And the other 63 are documented as unvaccinated. So what we're seeing here is an outbreak of measles in an unvaccinated population, predominantly children. The children, those cases, the 68 cases between 1 and 18 are all children who should have had at least one shot at that point. But we've got an outbreak of measles in basically in unvaccinated children.
But it has slowed down, hasn't it? But it's still considered an outbreak.
So here's in terms of the definition of an outbreak is defined as the incidence of disease or the occurrence of a disease in excess of what you would expect. Mm-hmm. For measles, we don't expect any cases. We shouldn't be seeing measles in Clark County. Until this year, we hadn't had any confirmed cases since 2011. That was 8 years ago. So even when we had that first case in late December, early January, that was an outbreak. I mean, if we had one case of smallpox, that would be considered an outbreak.
Okay.
One case of measles is really an outbreak. So we will define this outbreak as being over when we go what we call 2 incubation periods without a case. And what an incubation period is a time from when you get exposed to the time that you're likely to get symptoms, which is between 7 and 21 days after exposure. If we go 42 days without a case, and I believe the most recent case was this past week, I believe it was the 14th or so, if we go 42 days after that, we'll declare the outbreak over. I'll be happy if we go 21 days, if we go 3 weeks without a case. But the numbers are getting smaller,
okay.
And I believe that our efforts to contain this have really helped with that. The numbers are getting smaller, but we won't declare it over until we go that 42 days without a case.
Okay. So what is the measles?
So the measles is a viral infection. It's a virus. And one of the things I want to say about this virus is it's exquisitely contagious. It's one of the most contagious viruses, organisms that we know of. If you're in a room, if you have measles and you're in a room with other people who are unvaccinated, none of them will get the disease. You can leave if you have measles. You can leave a room, and 2 hours after you've left that room, it's airborne. It stays in the environment. People can get measles. It's that contagious. Wow. Even 2 hours after you've left the room. If you get exposed and you're unvaccinated, you're susceptible. Somewhere between 7 and 21 days, you'll get symptoms. And the early symptoms of measles, which makes it problematic during this time of year, are what you'd see in other respiratory illnesses. So you'll have a runny nose, a cough, and a pink or red eye called conjunctivitis. Actually, we call it the 3 C's because a runny nose, the medical term for that is coryza. The medical term for red eye is conjunctivitis. So cough, coryza, and conjunctivitis, along with a high fever. Those are the early symptoms. You're incredibly contagious during those early symptoms, and you don't know you have measles yet until the rash appears, which can occur several days after those early symptoms. And the rash generally starts on the head and the face, and then gradually moves down to the rest of the body and the arms and legs. So, and you're contagious 4 days after the rash begins. So you've got about, at least a week of being contagious. What's frightening is you're contagious early on before you even realize that it's measles. The only way not to realize that it's measles or be worried about it is if you're vaccinated, so you don't get it in the first place. The other thing I want to say about measles is it's not, despite the misinformation that's going on around social media, it is not a benign illness. It can be a very serious illness. Before we had vaccinations routinely used in the United States in the early 60s, 400 to 500 people in the United States died every year. About 1 in 1,000 people who get measles will get encephalitis, which is a swelling of the brain that can lead to damage, including deafness. Before we had vaccination, 4,000 people in the United States every year got encephalitis or swelling of the brain. About 48,000 hospitalizations every year in the United States before we had the vaccine. You can also get pneumonia. There are a number of different complications. The mortality rate from measles is about 1 to 3 per thousand. So out of every 1 to 3 people who gets measles, they will die. And what's particularly concerning is that there are some groups that are at higher risk from measles, which we can talk about, but particularly infants who generally are too young to be vaccinated, pregnant women who should have been vaccinated as children, but if they're pregnant and unvaccinated, they're particularly at risk of complications, including miscarriage. And then people around us who are immunosuppressed, they may be on cancer chemotherapy or have some other immune suppression. They're particularly at risk of getting infected and getting a complication.
Okay. What should you do if either you believe that you have measles or a family member? What should you do?
Yeah, well, one of the things you should not do, so I'll start with what you should not do. If you believe you have measles, you should not go to an emergency department or to emergency room or a doctor's office, because you're exquisitely contagious, and who are you going to find in an emergency room or a doctor's office? Infants, pregnant women, people with immune suppression. So you put other folks at risk. So you should stay home. You should call your healthcare provider, call your doctor. Certainly if you have a life-threatening emergency, you need to call 911, but you should call first and if you're calling your doctor's office or the emergency room, let them know you're concerned about measles. We've given information out to healthcare providers on how to safely see people who are measles suspect without exposing everybody else in the doctor's office or in the emergency room. You might note that during this outbreak, we have had exposures that we've had to deal with in clinics and emergency rooms.
So, you mentioned it earlier, how can we prevent measles?
Well, there's a very simple way to prevent measles. This whole outbreak was completely, utterly, 100% preventable. We have an incredibly safe, effective, and cheap vaccine that provides lifelong immunity. 1 dose of vaccine, 93% effective. 2 doses of vaccine, and 97% effective. If everybody got vaccinated, we would be able to eradicate measles. We thought we had measles eradicated nearly 20 years ago, but we've seen an upsurge in cases because we still have populations that are unvaccinated.
Now, and you said everyone should get vaccinated if they haven't been vaccinated. What about, for example, I think I was, when I was a kid, vaccinated when I went through school.
Yeah, so there's a couple of things that you can do. By the way, there are people, one of the things I mentioned is, we have to be careful. Pregnant women who haven't been vaccinated before shouldn't get vaccinated. Infants, unless we get pretty nuanced here. If they're 6 to 11 months old and they're traveling to a country where there's a lot of measles, they should get vaccinated. But otherwise, everybody should be vaccinated somewhere between the first shot between 12 and 15 months of age, and then the second shot between 4 and 6 years of age. Obviously, there's very rare medical contraindications. A child with a severe immunodeficiency shouldn't be vaccinated, but virtually the rest of us should be vaccinated at 12 to 15 months, and then again at 4 to 6 years. If you're an adult born before 57, virtually everybody was vaccinated with measles before. Virtually everybody born before 57 experienced measles because we didn't have the vaccine at that time, and it's so contagious, virtually everybody got it. Those people are probably immune. If you want to be sure, you can get your titers checked. You have a blood test to check that. if you work in healthcare, you should get your titers checked. Or in healthcare, or you work with populations that are at risk, you should have 2 shots.
Okay. Okay. How safe is this vaccine?
The vaccine is incredibly safe. We've had millions, if not billions, of doses given out. There's a lot of misinformation about the vaccine that's out there, and I want to counter some of that. One is that the vaccine causes autism. That is not true. That is total nonsense. It's been debunked many times. There is no relationship, no association between the vaccine and autism. There's also this nonsense on social media, and I got to say, nonsense is what it is, that people who get the vaccine can shed the vaccine virus and infect other people. That's been studied extensively. There's been no documented transmission of the vaccine virus from one human being to another. So even if you have somebody in your family with, for example, immune deficiency, you should get the vaccine. Those are exactly the kinds of folks that need to be protected by having all of us being vaccinated. So it's safe in those situations. There are very few medical contraindications to the vaccine. One might be a severe immune deficiency. Another one might be a severe allergic reaction. Those are incredibly rare. There's nonsense out there about the vaccine causing seizures. Well, anything that causes a fever, and you can get a fever after a vaccine, can result in a febrile seizure, child febrile seizure, which are horrible to look at, but they're generally benign. Measles, which causes a high fever, is so much more likely to result in a febrile seizure than the vaccine is. There's also, rarely encephalitis from the vaccine, incredibly rare, much more likely, far, far, far more likely with the disease, with measles itself, than it would ever be with the vaccine. So the vaccine is very safe. I mean, it's very effective and very safe, but there's no heavy metals in the vaccine. You can take a look at the ingredients. It's a safe product.
But yet there's this misinformation out there, and you've talked about this. Some of it's very sophisticated looking. How do parents decide? I mean, what recommendations do you have?
Well, that's what's so difficult for parents, and I think the parents who are hesitant about vaccinating their children care about their children. I mean, nobody is questioning that. I know that they care about their children, and they respond to some of this information. You can go to some of the websites. I think it's called Physicians for Informed Consent, and it looks scientific and it looks real, but it's nonsense. One recommendation to parents, talk to your doctor, talk to your child's healthcare provider about it. Don't just, rely on stuff you hear on the internet. On social media. I know there are folks out there who are responding on social media are convinced that their children have suffered some severe effect of the vaccine. The problem with that is I think that there's a difference between causation and association. So because things happen at similar points in time, I think it's easy, especially if there's misinformation out there, to assume that one thing caused the other. We get that first shot for measles, mumps, and rubella at 12 to 15 months. That's the same time in development that children are being diagnosed with, for example, autism. People draw a conclusion between that, even though thousands upon thousands of studies have shown there's no association between receiving the vaccine and autism, for example. So I tell parents, talk to your healthcare provider about that so you get the appropriate information. The other thing I tell parents, and we need to listen to parents who are concerned, by the way. We need to talk to them about this stuff and listen to their concerns. The other thing I tell folks is that one of the reasons to vaccinate your children is not only to protect your children, but to protect everybody else around us.
Which we have been seeing, yes.
Right. So, during this outbreak, we've actually had to provide something called immunoglobulin, which is antibody preparation to infants who are exposed to cases. We've had to give it to pregnant women as well. So one of the reasons for vaccinating your children is to protect everybody around you. I know that some folks on social media accuse public health of, wanting to mandate vaccines. I'm not suggesting that we hold anybody down and force them to have a vaccine. We're saying that if you're going to have your child in a school, in a congregate setting where there are other children, there may be infants if there's a daycare there may be children in school who have, cancer on chemotherapy.
Mm-hmm.
If you're going to have your children in school, they should be vaccinated. You can still choose to homeschool your children, but nobody's mandating anything.
Okay. We're quickly running out of time.
Sorry,
No, it's fine.
I can go on.
The one thing I do want to talk about, right now we're talking about an outbreak of measles, but the same thing I would assume will apply with the other vaccinations. If it could be another disease next if people aren't getting immunized.
Yeah, and we've heard about the child in Oregon who had tetanus. I think you heard about that case. I used to see when I was early on, I'm fairly on in age here, but in my early days, used to see children with meningitis due to something called Haemophilus influenza. They'd also get something called epiglottitis, where they're swelling of the flap that covers the airway. We don't see that much anymore because that's one of the immunizations we provide. But there's other vaccine preventable diseases that are pretty horrible that are preventable.
Smallpox.
Well, yeah. And actually smallpox is a good example. We don't get smallpox vaccine anymore because we basically eradicated it from the earth. If we were able to do the same thing with measles, we may not need measles vaccine anymore. But unfortunately, here's the problem. We got measles in the world, and not just in other countries, but we've obviously got measles in the United States now, so it's only a car ride or a bus ride or a plane ride away. And we've got unvaccinated populations. So it's just a recipe. What we had here in Clark County is inevitable, and it will be inevitable in the future if we don't get vaccination rates up.
Okay. If people want more information about measles, where can they check?
They can speak to their healthcare provider, their physician. They can call our health department as well.
Yeah, and you have a website, clark.wa.gov, public health/measles investigation.
Yes.
That gives the latest information, and your phone number 564-397-8403.
That sounds correct.
Okay. Well, thank you
Thank
very
you.
much, and thank you for getting us through this.
Okay, thank you.